to all. Let me congratulate you for the resilience and patience. We had definitely exceeded the time. I will not do any recap program. Let me just draw a couple of conclusions. First of all, we are happy for celebrating 20 years of this conference, which managed within this 20-year course to concentrate the biggest players of the health sector, the whole political system of all political parties that were always represented here, the big companies of the health sector, and not solely pharma industry and medical technology and others, the public sector, of course, of Medicare, and important part, I would say practically the whole of the academic community that is related with this subject. I believe that I thus express a broad view shaped during those 2 days that this conference was the best ever. Not only because it had a very productive and heavy agenda, but also for 2 more reasons. The first is that all who are involved in this field were present. And the second is that they demonstrated a spirit of strong consensus and preparedness and will for future cooperation. With regard to the substance of this conference, allow me 2 comments. The first is that the pandemic has divulged the deficiencies, the distortions, and problems of health sector through time. And it also revealed that we may do well in certain aspects, but others not. We did well in the pandemic during the first period with the lockdown and the organization of the vaccination program, but we didn't do that well with regard to the demand, the attitude that is not only of health professionals but also citizens, because we lacked a communication policy, a serious and documented communication policy. We lacked the community-oriented action that public health policies demand, so as to have a more cooperative and disciplined population. The pandemic has revealed the paucity in public health services and the distorted and very small effectiveness and efficiency of the first-degree health services. And this conference demonstrated that these must be the main pillars of the reforms from now on. And I conclude by saying that the common denominator of all that, and many others, such as technology, is the lack of resources due to a more than 10 years of crisis have taken away from the country. I remind you that in 2009, our expenditure was 22.5 billion euros, and last year were 14.5 billion euros. That is, with 8 billion euros less, we must perform, we must do the same job and perhaps more due to the demand and the increase of needs, and perhaps more job because the cost of health services during those period, of course, was raised. So vis-à-vis this problem, from my view, the main conclusion of the conference is that we need a very steady funding basis. We have to break the alarm that health insurance in Greece, social security that is faced with a major problem which in the short term will become flagrant and it will be more obvious. Therefore, we need a broadening of the funding basis, and also we need a series of rules and incentives, I mean regulations by that must be implemented both by the users and the suppliers. And the breadth of those rules, that is, the state rules, is in inverted relation of the incentives. Therefore, we have to find a golden mixture, stick and carrot of incentives and rules and regulations, a mixture that we will have the consensus both of the suppliers, the physicians, and the users of the health system. So for both to seek, both parties to speak the best and more interesting solutions, because the future will be very ominous. It reminds me this renowned bestseller of 1985, which one of the Victor Hughes wrote. The bestseller had the title, Who is to Live? Making a projection of the cost that technology, health technology, and increased aspirations of citizens brings about. Therefore, on the basis of the broadening of the insurance base and the incentives, we must make the necessary choices, which should be based, and this I will say, placing great emphasis, we will be based on the selection, on the choice of the citizens. The structural monopoly attitudes that exist in the field of supply, especially of the overall physicians' monopoly on these terms, cannot be minimized unless a great part of the power is transferred to the users, the citizens, that is, and especially the patients that we had also present in this conference. And I believe that we will have them with us even more so in next conferences. Thank you for your patience.